And when you see I love going to MAPS because I hate biochemistry, and I've learned so much from going to MAPS conferences on how cellular biology works, how the respiratory chain works, how the mitochondria can actually form ATP with cofactors like coenzyme Q10 and carnitine that brings the fatty acids into the cell. And if you don't have oxygen to make that cycle work, it's not going to work. If you don't have CoQ10, a lot of mitochondrial kids, you'll do a lactate or a pyruvate level on them, it'll be sky high, because that's saying that the carnitine shell is not working. That means that glycolysis is not working. They can't do the Krebs cycle. They can't make ATP. And you give them carnitine and CoQ10, you give them some oxygen, and lo and behold, their mitochondria works better, and their lactate and the pyruvate gets better. And they are better. That's again, we do all these tests and we do monitoring, but the end result is we want to make the child better. So from a clinical point of view, that's what I look at. Chemists and biologists, they look at labs and this and they're helpful guys. But you got to treat the person who has the disease, not the disease the person has. And then you got to treat with looking at the labs as guides, not the way that the Bible should be written. So Tybo is Billy Blank's pretty famous in the States on doing this exercise Tybo. And I saw him at a National Autism Association conference in November 2011. And they put a chamber in his workout. So this guy works out 4 or 5 hours a day, solid, really funny guy. And he was in a chamber for about a month. When I say going in a chamber, it means you go in for an hour in a hyperbaric chamber. It's a small portable unit about the size of that table. It's 8 feet long and 3 feet wide. And it's portable. You can use it with room air. You can take an oxygen concentrator and put it in, having so that oxygen will fill it up and the ambient pressure will be, here is 21% in the chamber. That gets compressed at 1.3 atmospheres to about 24% effective oxygen. With extra oxygen through the oxygen concentrator, it's about 28 or 29% oxygen in the chamber. But you go in for an hour and 15 minutes, and you come back out. And if you want to go back in 4 hours later, and then come back out, then you've gotten 2 sessions in a day. And he says, I can recover from my workouts so much faster. Between workouts daily, I go for 2 one-hour sessions. I'm astonished with the good memory I've gotten. I'll continue to use it daily and spread the word. A lot of athletes, professional sports teams use this. How does it work? So according to Henry's law of physics, an increase in atmospheric pressure allows for more gas to be dissolved in any given liquid. Henry's law is displayed in every can of soda, hopefully without high fructose corn syrup, please. When the can is in the factory, it's put under pressure, so more carbon dioxide can be dissolved into the soda, causing it to be carbonated. You don't know it's there until you open it up. When the can is open, the pressure is released. Without the pressure to keep it dissolved, the soda will become flat in a few hours. Same principle exists in us. Oxygen in the plasma and the liquid portion of the blood. When the body's under pressure, plasma, the cerebral spinal fluid, the synovial fluid will dissolve more oxygen in it than it wouldn't if there was no pressure involved. And this puts an increased amount of available oxygen to the tissues and allowing the oxygen to reach the areas of the body it normally wouldn't reach. So Dan Rosenthal and a number of other docs did a double-blind placebo-controlled study, randomized, to show that children with autism who received hyperbaric oxygen at 1.3 atmospheres with no extra added oxygen, 24% oxygen, for 40 hourly sessions had significant improvements in overall functioning, receptive language, social interaction, eye contact, and sensory cognitive awareness compared to children who received slightly pressurized air. You had to give them a little bit, so it was 1.03 atmospheres versus 1.3. Because you had to feel the pressure in your ears so they would know it was a placebo versus you had to give them some kind of a pressure. And this was a very good study that was reproducible. So hyperbaric oxygen, how is it useful in autism? In autism we have decreased cerebral perfusion, increased oxidative stress, increased inflammation, increased inflammatory cytokines. We can measure TNF-alpha and NF-kappa B. We call it a neurodegenerative disorder by many. But hyperbaric has been shown to increase cerebral perfusion, decrease oxidative stress, decrease the inflammation, reduce the inflammatory markers measured in blood and in cerebrospinal fluid. And it actually has been shown to increase stem cell release for neurologic tissue repair. These are SPECT scans. So SPECT scans are measuring not anatomy, but function of the brain. And many of you know this. So if I say things that you already know, please forgive me. But the blue areas of the brain are the areas that are having poor function. There's not a lot of activity, not a lot of metabolic activity going on. We're measuring metabolic activity before and after 10 hyperbaric sessions on the same 4-year-old autistic child to show perfusion and metabolic activity improvements before and after hyperbaric therapy. 10 treatments, 1.3 atmospheres. So when you use hyperbaric oxygen therapy, and we really should call this mild hyperbarics, that's all I do. I don't do the big heart chambers with 100% oxygen that you have to be a little more cautious about fire or in that regard, or pulmonary barotrauma if they hold their breath and coming up there higher quickly. I do diving medicine also, so I'm familiar since 1992 with using hyperbarics for diving-related injuries. But we find that it's extremely helpful for a whole host of items, which I'll share with you in a few seconds. But when using hyperbaric oxygen, the oxygen is forced to the tissues, the organs, the brain, and fluids throughout the body inside the pressurized chamber. Oxygen floods the areas that are oxygen starved to stimulate cell growth, and it enhances neurologic function due to oxygen saturation. A lot of people have problems with clostridial infections. Clostridium is anaerobic. Doesn't like oxygen. We get a lot of people with GI yeast overgrowth. We put them in the hyperbaric chamber, we knock that down as well. Classic ADHD story. So Josh is, I think he's about 12 or 11 here. Has anger issues, behavioral issues. It started in preschool. He'd scream at the teachers and other children, and once in a while threw a chair when he was 4 years old. He was diagnosed with ADHD at 7. At age 9, from December 9th, that's at age 9, from December 2006 to April 2007, he had 41-hour sessions of hyperbarics in my office, going 3 times a week. Approximately after 10 sessions, a noticeable improvement in his anger and behavioral issues were evident. I added Learn at that point to help with his focus. He was speaking perfectly well. Usually I use Speak first as my product of choice to get the kids to start improving their alphabet and trying to get comprehension of the sentences. He didn't have any problem with that. He needed to focus. So fish oil, as you know, is so helpful in focusing. So I put him on Learn, and that really helped him focus quite a bit. After 40 sessions, the teachers and parents were asking the mother, what is he doing? Because he's gotten so much better. Organizational skills, his anger got better. He started losing it less frequently. Losing it meaning he's going off the wall and being a banshee. After 16 months off of the chamber, because he did 40 sessions, and he stopped. So a year and a quarter later, his anger started to come back. And he came in for 10 sessions of hyperbarics. And once again, he got right back to where he plateaued off at 40 treatments. So he didn't have to go back for the whole session. Once he's been doing the therapy, he was able to get to a certain level and then maintain himself. Another 5 months later, as a teenager starts to become more problematic, his anger came back. He had another 4 sessions. 3 months later, he had another 6 sessions because he wanted to study for big tests so he can get into a better quality school. Because in the States, we have to study for these big tests from time to time. And he's like, I can focus so much better when I go in the chamber. So he came in, he did his whole prep for his school testing, he did fantastic. Started having anger outbursts again. We tried to do various things, but as teenagers, they all have difficult times. Mom said, you're going back in the chamber for 4 more treatments. So Mom would go in also, because these chambers are large enough for a mother and a kid to go in. When you use the mild chambers, the hyperbaric oxygen chambers, I'll show you a picture of one in a few minutes, you'll see that it's safe and it's helpful to allow for Mom to go in the chamber. We want to have a quality to take care of the kids. So to get an autistic kid in, you have to bring some kind of device So you can bring in a DVD player, or you can bring in a computer inside of these items. In the heart chambers, you can't do that. So we find it's very versatile to be able to use this stuff. I did a case with a spinal cord injury. Bridget was a 58-year-old lady with 8 years of spinal cord tumor removed. She needed 1 to 2 canes to walk around. She had severe pain in her entire spine, unable to shower, change her clothes without excruciating pain. She came to me like it was the last-ditch effort. She heard about hyperbaric on the internet, and this helped her. I said, I have no idea, I've never treated that. So we had multiple surgeries, and multiple narcotics, and no significant relief. Hyperbarics is the last option for her. So she came into the office. I swear this happened. On this 4th treatment, she put down her quad canes at the front, and she screamed out at the top of her lungs, "This is the first time in 8 years I've not used a cane." Screaming. She walked up after that without a problem, continued for 20 treatments or more. She showers and changes clothes without a problem. And her biggest thing that she wanted to do was to walk up to get the offering in front of church. And she wasn't able to do that, and now she was able to do that. And that was so huge for her life. I have to wrap this up, so I have just a few more slides I want to just get across to you. So it can be acting antiviral. It helps with reduction of cancer cells. It's been very beneficial for off-label indications such as autism spectrum disorder, ADD, ADHD, PDD, and Asperger's, Parkinson's, multiple sclerosis, autoimmune disorders, arthritis, scleroderma, Crohn's disease, inflammatory diseases, chronic infections, yeast overgrowth, Lyme disease. It's not going to kill the spirochete at 1.3. You need 2.4 to kill spirochete, but you will reduce things. Stroke, memory loss, traumatic brain injury, improved fracture rates, myasthenia gravis, improving, and chronic fatigue syndrome. That's Mike coming out of a chamber. That's what you have when you get to take one to your home. He's an Asperger kid with Lyme disease. I don't have a lot of time to get into the details of this case. I want to just hit a quick clinical presentation. How much time do I have left back there? 5 minutes?
5 minutes, yes.
Okay. So the advantages of hyperbarics: improved circulation, diabetic and peripheral neuropathy, spinal cord trauma, memory enhancement, chronic fatigue, and digestive problems have been improved with hyperbaric oxygen. Sequentially, you want to give it 4 or 5 times a week for 40 treatments. Many autistic and Asperger kids will see great benefits. And fractures and peripheral vascular disease will improve. We have about a 40% reduction of crime and gas when we use hyperbarics. I won't get into that one. These are some of the sports players that have hyperbarics. The cover of Inside the Central Super Bowl 43. You had Heinz Ward sitting in there for the Pittsburgh Steelers, and he was photographed and interviewed next to his hyperbaric chamber. It's like, why are you going in this? Will I recover so much faster from the injuries in the football game? I got Super Bowl coming on. I need to take care of this. Terrell Owens, he had a fracture of his ankle just before Super Bowl Sunday. About 3 weeks before that, it was 6 weeks before that. And they said you're not going to be able to play, and he went to the chamber, and he was able to play, and he actually had a touchdown reception that year. So you can safely use a conveniently rented chamber for your home. Multiple 4.2 psi sessions are done. That's what they look like. So whether you're above the trees or taking a plunge below, don't let the environment bite you in the butt. Fix the terrain, and ask your doctors to offer health improving options by thinking outside the box. I don't have time to go through the clinical presentation on that, so I apologize for that. I want to leave room for some of the other speakers here. I want to close with my closing slide and say Muta Shakar for your active interest. If you get an opportunity, please look at my website to I said that thank you very much for your
معلش يا جماعة ثانية واحدة بس وفقرة التساؤلات هتبتدي. دكتور ديفيد هيكون يرد على الأسئلة، ولو في أسئلة عن منتجات السبيك هيرد علينا فيها مستر بيل فرويز البرودكت مانجر في شركة نورش لايف. Thank you, Dr. David, for this brilliant lecture and reliable information. لو في أي حد ليه تساؤل بس يعني يقول لنا عشان نجيب له المايك.
Well, you said, how do you have two children with the same parents and the same genome?
The same parent, the same genome,
Right.
the same environment. One of them is autistic and the other not. That's why, because I'm impressed by you.
So I had a case very similar to what you're describing, where I had a mother come in and she had 3 children, identical, triplets.
Yes.
Susie was terrible. The other 2 were totally different. And she came to me and said, what happened to Susie? Tell me how this happened. They were, I think, 6 years old at the time when they came into the office. And Susie was really difficult to control, bad autism. And like, how can this possibly happen? What happened to my daughter to change her? I said, when did this occur? She said, it was January 6th. I know the day this happened. Because it was 2 days after her vaccine. But my other kids had the vaccine too.
Yeah.
We all had the same food. We all had the same everything. But my child had a reaction where she had diarrhea, she had a fever, and she lost her recognition of me, wouldn't speak anymore, wouldn't point. I think she was around a year and a half at that point when this occurred. And I said, okay, I looked at the shot records. I said, you can't blame the shots, you can't blame the shots, what she's telling me. I said, I'm not blaming the shots. I'm just trying to see what's going on here. And I noticed, she said it happened 2 days after she got the MMR and the varicella on the same day. But the other kids got the MMR and the varicella on the same day, they didn't have a problem. So it's a perfect answer to your question on this one case. And I said to her, okay, what was going on with your daughter beforehand? Was she sick? She says, oh yeah, she had that slap face thing, that roseola, that other virus in her system. And I told the doctor she's got a rash on her, and the doctor said, no problem at all. And he gave her the 5th vaccine, not 5th disease. She already had 1 virus in the system, and then they had the MMRV. So she had 5 viruses going in her that day, and the other kids only had 4. Was that the tip of the iceberg? It seemed logical in that case, because all the kids had the same vaccine schedule that she did, but she had an ongoing disease at the same time. And did that cause it? A plus B equals C in my book. It's a very strong reason for it. So you have to think about what is going on besides what we can diagnose. Like, what else is causing problems? Because, like you said, they're all SIDS, they all have the same genome. So how does this occur? So in that case, it was because she had another thing going on. You have to look at what they eat. Kids eat different things. They're not always eating the same thing. So maybe one child eats more pesticides, or one child's exposed to another product when playing with their friends and tumbling in the pesticide field. Things in that regard. Anybody else?
Yes, the second question, please. Now we're talking about DEMS as chelator. Is it general or specific for some?
It's a general chelator. It's a sulfur group.
For how long are you using?
How long did you use it for?
Yeah.
So you could use it safely. You should really be trained on how to use it. So I don't want you to walk home and say, oh, you told me I could use 25 milligrams per kilogram, and then 10 milligrams per kilogram dose, and do it in a certain sequence. And you should really be trained appropriately. But I'm answering your question, how long can you do it?
Yeah.
What I would do is I would monitor the urine challenges and see if their volume of metals being removed goes down. And if their volume of metals go down, and they're safe, they're all down in the green zone, I'll say, okay, let's not chelate you for 6 months. Let's do something else. And then let your deep cells, because what's happening here is you have the target organs, the fat cells, the kidneys, the adrenal, the brain, is where the metals store. And if you get rid of the areas they can grab onto through the chelator, then you're in good shape. But after a while, you have to wait for the deep tissues to release. So you can chelate and chelate and chelate, and then you find the levels are low, do something else for 6 months, you say, no, I'm going to do another challenge on you now, and see where you are, and lo and behold, it'll say, wow, some of the deep tissues came out. Or did you put new bad metals in your system? Let's do another hair analysis and see if the faucet's been opened again. So that's how you would do it. And how safe can you do it? Until the person gets the desired response, has no metals, you do it 6 months later, have no metals, fine. But if you find down the road, now the kid's old enough and can do IV chelation, then do an IV and see if a one-time dose of IV chelation works. You have to get up to the right level. So you stepwise it up. You know, if it's a kid, little one,